I realized that this is the time that I should quit.
Nurses make up the bulk of healthcare workers, and 90% are women. And since the beginning of the pandemic, there has been an exodus of nurses from the public system in Quebec. Tens of thousands of them have either gone to the private sector, left to work in other provinces, or even left the profession altogether. And thousands more are on leave. But experts say this is not just a pandemic problem. They say that the roots of the problem go much deeper and that the solution is about how we think of nursing as a job. The history of settler nursing actually begins in Quebec in the 1600s. In 1641, Jeanne Mance arrived in town. Mance was a French nurse and the member of a religious order of Jesuits. She created one of the first hospitals in North America, Hôtel Dieu, and basically helped found the city of Montreal as we know it. Nuns like the Religieuse Hospitalière de Saint-Joseph continued Mance's work and ran Quebec's hospitals for centuries. So it was a religious calling, but still one of the first real careers women could have.
Caring work has been set up since the 19th century in most Western societies as a woman's work.
In the early 20th century, nursing schools were created. The vocation was becoming a formal profession. But even then, it was limited to women.
This ambiguous relationship between a vocation and a profession had been a very big burden on the nursing profession since the start.
Nurses say the fact that nursing was and still is a mostly female profession meant it was harder to get the recognition and the pay they deserved.
Gendered role is one thing, sexism is another. So healing and caring is often something we see in matriarchal societies as gendered divisions of labor. We see that the caring role is actually considered something of great honor that brings prestige and that brings respect. Modern nursing was founded in the Victorian era based on very sexist, prejudiced perspective on gendered roles.
Nurses have been fighting against those notions for decades, but in the 1960s and 1970s, something changed. Huge worldwide movements for women's rights took hold, and for nurses in Quebec, a new ally joined the fight. Unions around that time made huge headway in improving salaries and conditions for nurses, but it was short-lived because in the 1980s, major labor shortages hit healthcare. And tensions peaked in 1989 when nurses went on strike against overtime. And then, typical for Quebec, the government came up with a healthcare restructuring plan, ostensibly to remedy the issues, but it only made things worse. By the mid-1990s, shortages got so bad that managers started to lean on clauses in healthcare and labor laws that basically stipulate that nurses must not abandon their patients. And that led to forced overtime.
Forced overtime is an especially feminist issue because that is really something that destroys your soul.
She looked at me and she said, "You will have to stay mandatory overtime today." And I said, "I'm not staying because I'm dehydrated. I feel weak. I cannot do an extra 8 hours. There's no way I can stay an extra 8 hours. I don't even know how I'm going to drive back to home right now."
The thing is, most of these laws or ethics codes also call on nurses not to practice if they feel they can't provide adequate care. And so the use of forced overtime, something that was intended only for disaster circumstances, started to become a common scheduling practice. Now, add a global pandemic to that.
At that point, it was very overwhelming, and I realized that this is the time that I should quit before I start regretting being a nurse.
According to Statistics Canada, weekly nurse overtime hours went from an average of 6.2 hours per week in May 2019 to nearly 17 hours per week in May 2020.
So they have not been able to take vacation. We force them to work full time. So that's very difficult for them because they can sustain this energy and be able to provide this care. That we cannot ask them this to nurses.
But for some, these problems aren't just about the pandemic or the staffing shortages before them. They're rooted in how we thought about nursing way back when as a vocation and not a job.
Our job is taking account every aspect of a patient's life.
On them, the burden of the pandemic is incredibly high, and they still are asked to perform the work as if it was their moral duty to do so.
And I think we need to review those wages, and we need to review the conditions and those ratios, because this is not something sustainable.
I've seen nurses just piece together a schedule that is just absolutely mind-boggling so that they can take some time off, they can take some vacation. And so the creativity and the incredible débrouillardise of nurses in this province and around the world is truly unbelievable, and yet it's hidden.
There is solutions. We've seen some organizations said, we will stop this, and then we don't have mandatory overtime, and they are planning better. They are engaging nurse as well, to think about this. So we know that it's possible.
What we're seeing is just how much of Quebec society depends on the well-being of these essential workers and just how much they've been suffering. And now that that's not so hidden anymore, nurses are hoping it can finally change.